Good morning. It's good to be with you again. And the last time we were together, we talked about vaginal rejuvenation. And I understand that the audio was not as good as we wanted it to be. So I thought I'd recap that just a little bit, which will lead right into the subject that we're going to talk about today, and that's pelvic floor disorders. Vaginal rejuvenation is a situation that so many women have trouble with. They have problems at menopause with a lack of hormones. They have damage to the pelvis from childbirth and other aspects of their life. And what happens is that no longer do they have the lubrication that they need. They have the pain whenever they're having intercourse. They're having numerous problems that they need addressed. And one of the things that's very encouraging is the fact that we don't always have to treat that with hormones. We now have the Mona Lisa touch, which is a laser treatment to the vagina, which restores the vagina back to its original condition well before menopause. So I think that's very important. Plus, we do have hormonal treatments that work in other aspects. But that leads right into pelvic floor disorders that so many women have a problem with. And we see patients all the time with problems with pelvic floor disorders. And one of the most difficult things is them being able to talk about it or just accepting it as normal. And that is not necessarily normal. It is a condition that they have occurred whenever they've had children and the pelvis has been damaged. Certain other chronic conditions like chronic constipation, smoking with a chronic cough, all those things can lead to damage to the pelvic floor, which results in prolapse and other pain disorders. Now, so often, as we talked earlier, we talk about urinary incontinence. So often these things are very much combined. You don't have just incontinence. You may have pelvic prolapse or prolapse of the bladder, or a rectocele, which is prolapse of the rectum. And these are prolapses into the vagina itself. Most commonly, yes, it does occur because of pregnancy and childbirth, but there are other reasons for that. But the evaluation of this is very important because you don't want to treat one if you can get both treated at the same time. Now, what are some of the symptoms of pelvic prolapse? One is pelvic pressure and discomfort. I've had a lot of patients say, well, I'm pretty good first thing in the morning, but as the day goes on, I get more and more discomfort in my pelvis. And that seems to be from just the effects of gravity gradually causing the prolapse to accentuate itself. Another very common one, and so often patients just don't think about this, they just think it's part of what life is going to be like, is they confuse a rectocele, which is prolapse of the rectum, with constipation. Now, granted, constipation is where you just don't go, but a rectocele can result in difficulty with a patient actually initiating a bowel movement or feeling like she got completely empty. What happens with that is that the rectum balloons up into the vagina during efforts to have a bowel movement, which not only I've had patients say, I can't get it started. It's all sitting right there, but I just can't get it started. Well, they lean forward on the commode or rock back and forth. I've actually had some say I have to reach and push on the bottom of my vagina to get the bowel movement started. And then I get up and 15, 20 minutes later, I got to go back and go again. Well, that's because of the rectocele. And it's so easy to get fixed now. We have made such tremendous advances in pelvic floor repairs and disorders that I think so many women just kind of accept what they're having to put up with as being normal, when really it's not, or just a factor of aging, or just a factor of having children. And it's not necessarily something you have to deal with on a regular basis. It's something that can be repaired, and most commonly permanently repaired, so that that problem is resolved for you. Another problem I see patients having is difficulty with urination. They have to go more frequently during the day. Their sleep is interrupted by having to get up at night several times. And a lot of times this is a result of pelvic floor prolapse, which comes from the disorders that we're talking about. Other things that can happen is certainly you can have certain pain situations with pelvic floor disorders where the muscles are either in spasm or damaged and having pain whenever you're just walking or carrying out your normal activities, in addition to trying to have intercourse. All of these things can be addressed with great success, and we're looking forward to the opportunity of helping a lot of ladies with that problem, as long as they approach us about it or say something. Now, I commonly will just ask those questions, but a lot of times physicians don't ask those questions, and if you don't bring them up, they're not going to be addressed. So that's why we're very glad to talk with ladies about pelvic floor disorders. Let's see here. Margie. Yes, Margie. Thank you for your question. Can I have an appointment without a referral? Certainly you can. You can certainly make an appointment. You don't have to have a referral. We don't require you to change doctors for us to fix your problem. Our main goal is to help you resolve that problem and get back to a normal lifestyle. So yes, you can call just to make an appointment without having to have a referral. If you want one from your primary care doctor, that's certainly fine. But realize you do not have to have that referral to be seen. Greta, let's see. Yes, Miss Greta. The difference between erectocele and constipation. With constipation, you just don't go. There's no urge to go. You just don't have a bowel movement. With erectocele, the stool gets to the rectum, but getting it out is a problem. And I know that's a difficult subject to talk about, but it is a common problem that a lot of ladies have. And it is so easy to have that fixed so that that's not a problem anymore. You don't have to rock back and forth on the toilet. You don't have to lean forward to try to have a bowel movement. You can have a complete emptying of the rectum and not have to worry about running back 15, 20 minutes later. So there are many things that we can do for you with pelvic floor disorders. The pain that you're having with intercourse could be from the uterus or the pelvic organs like the rectum and the bladder prolapsing into the vagina, and of course it's uncomfortable during intercourse because they're in the way. All of this can be easily corrected, and most commonly very permanently corrected. So don't ever hesitate to bring that up. Feel free to call us and come in and get an evaluation. We certainly look forward to making your life as normal as possible and getting you back to the life that you really want to have versus having a problem with pressure, pain, incontinence, difficulty with bowel movements, difficulty with intercourse. Have a normal life again and quit worrying about the others and leave that worry up to us. Thank you for joining us and look forward to talking to you again soon.